Patients that suffer from chronic sinusitis or recurring acute infections, recurring acute sinus infections, they usually are going to benefit from some sort of sinus procedure. Right? So the goals of sinus procedures are the same regardless of the type of instrument that you use to perform the procedure. Right? So the goals are to improve the ability of whatever sinus you're treating to ventilate with the outside world. So improve ventilation. Right? The second goal is to improve the ability to deliver medications if you have chronic sinusitis. Because remember, if you have chronic sinusitis, that means you have inflammation that we need to medically manage with topical things like topical steroids. So if the medication can't get to the area that's inflamed, then you're not going to be able to manage that area with topical medication. The third goal of sinus procedures is if you have a lot of sinus disease, which means you have a lot of inflammation to the point where maybe the sinus is so swollen it's like completely full of inflamed tissue, then we can't just simply dilate a little area and expect all of this inflammation to go away. We actually got to go in there and get some of that out of there for you, debulk that disease. So in that case, that may direct the type of procedure that you need. So it's how much sinus inflammation that you have, where it is, and the goals of the procedure that are going to dictate which technique that we use. So the basic techniques are going to be either dilation techniques, which involve a balloon instrument like this, which only dilates pathways, or more conventional endoscopic sinus surgery techniques that actually remove tissue. And by remove, I don't want you to think like these things are like femurs of bone in your sinus. These are eggshell thick partitions of bone that we remove, permanently remove, they're gone forever, to permanently open certain pathways. So they don't grow back, it doesn't regrow. But remember, sinus procedures are just one piece of a treatment algorithm that involves medication. So if you're a patient that has a lot of sinus tissue inflammation, you have to remember the procedure is only one step in managing that inflammation. You have to do the medication portion. Otherwise, you can open the sinuses all you want, but the lining that's left behind is still going to be inflamed and you'll still suffer from sinus symptoms. So after the procedure, that day you're going to ooze a little blood. I mean, it's a procedure. Good news is I don't put packing in, I don't do splints. Actually, I don't do packing or splints regardless of how much surgery I do. So whether you have an office procedure or a hospital procedure, I just don't find the need to put those things in patients' sinuses. It makes you very uncomfortable. So because I don't use packing, I don't use gauze and splints, you're going to have some oozing for about a day. It'll stop. And then the next day you're going to start rinsing your nose with sinus irrigation wash, which is just salt and water. And you'll do that several times a day for about 2 weeks. At about 2 weeks, you're going to be 80 to 90% healed. So you heal very quickly from sinus procedures. The follow-up visits are typically, if I just do dilation alone, I see you about 2 weeks after the procedure. If we do something that involves a little more traditional work, then I'll see you back at 1 week. At 2 weeks, make sure things are healing well. And the nice thing is at 6 weeks, regardless of how you've had your procedure done, we do a nasal camera exam in the office and I take photos of your results and I show you what your sinuses look like before we did the procedure and then I show you what they look like after the procedure.